Moving on to the health sector, the Lagos State government has inaugurated over 100 nurses from both public and private facilities across the state as blood transfusion champions. This is after a training exercise aimed at ensuring safe blood transfusion practices in Lagos. Our health correspondent Aminat Elegushi has the details.
Here are over 100 nurses drawn from both public and private hospitals, including federal health facilities. The gathering, organized by the Lagos State Blood Transfusion Committee, is to train the nurses on ensuring safe blood transfusion practices. Special advisor to the Governor on Health, Dr. Kemi Ogunyemi, who acknowledged the role nurses play in the transfusion process, emphasized the need to adhere to all the transfusion policy and procedures.
We must have a written policy that every single one of you must read and pass on to all your other members of staff. That is the only way we can ensure that there's safety and our patients are protected. And guess what? You are protected. You cannot give blood on your own. You must watch your patient. You cannot give somebody else to watch your patient. As soon as that blood starts, that patient is your responsibility. If anything happens to that patient, it is your fault.
You don't just give blood transfusion to people. You must ensure that we follow the standard procedure and the standard protocol. Number one, we must ensure that two people verify the blood before you give. You must ensure that the blood type, the habeas blood group system, matches with the patient. Cross-matching, the resource factors, the antigen, and everything that are compatible with the clients or the patients that we are giving us.
It's important for the nurses to not just have a mental knowledge of what the transfusion reactions could be, but they should be able to recognize such transfusion reactions, because we know that even though blood transfusion can be a life-saving intervention, it is also fraught with a lot of complications, and a lot of these complications could also lead to death in the patient. And so we want to make our transfusion practice in Lagos State to be as safe as possible.
Executive Secretary of LSBTC, Dr. Bodun Yoshikumaya, reiterates the state government's commitment to ensuring patients in need get safe blood.
So the nurses are deemed to be the most critical part of a blood transfusion because they are always there. They will be there from the beginning till the end. So they are the ones that are closest to the patients. They are the ones that will say if there is a reaction or not. They will say if the blood transfusion has gone smoothly or not. They are also there to ensure that the blood is actually of the good quality that we expect that it should be transfused.
Lagos State is interested and committed to professional development of all our healthcare workers across cadres to ensure that eventually any blood that is transfused in Lagos State is one that is of good quality and one that is transmitted without any adverse effects as much as possible.
They have added more knowledge to us, and we will pass this knowledge as well to our subordinates in our place of work for more improvements and for a better care to our patients.
Commissioner for Health, Professor Akin Abayomi, presented certificates to the trained nurses as blood transfusion champions. Aminat Elegushi, LTV News.